anticoagulants, we are going to first look at the coagulation cascade. So this one is divided into the intrinsic and extrinsic pathways. The intrinsic pathway is triggered by injury to the blood vessel wall, while the extrinsic is triggered by trauma to the vascular system. So, in the intrinsic pathway, we are going to start by activation of factor 12, and the activated factor 12 is going to lead to reactions which are going to activate factor 11. We are going to have activated factor 11. Then this one is going to activate factor 9. So activated factor 9 is going to activate factor 10. So activated factor 10 is going to lead to conversion of factor 2, that is prothrombin to what? To thrombin. So we are going to have this reaction. Then thrombin is going to lead to activation of fibrinogen, converting it to fibrin. As we saw in antiplatelets, fibrin leads to aggregation of the platelets. So in the extrinsic pathway, we are going to start with factor 7. So activated factor 7 is going to activate factor 10, leading to a bridge of these two pathways. So here we are going to have drugs which are going to be directly targeting to certain factors in this cascade. They are going to confer their anticoagulant effect by inhibiting some factors here. For example, the commonest the drugs we are going to start with we have heparin and low molecular weight. Here we have drugs like enoxaparin and dalteparin. So this one, they are going to inhibit thrombin and factor 10. They are going to inhibit thrombin and factor 10. But low molecular weight heparin, where we have enoxaparin and dalteparin, they are selective and specific for factor 10. So these ones are selective for factor 10. Then the side effect here, we are going to see with heparin, we are going to see heparin-induced thrombocytopenia. And how can we deal with heparin toxicity? By bringing in a drug called protamine sulfate. So this drug is going to counteract the effect of heparin. So it's going to act as an antidote on the Parinax. Parinax is going to come and inhibit factor 10. We're going to have other drugs which are direct inhibitors of factor 10, and these ones this one is going to be rivalopizatan and ixaban. So those ones, they have direct inhibitory effect on factor 10. Also, we are going to see drugs which have indirect inhibitory effect on factor 10. So which have indirect inhibitory effect on factor 10, they are the thrombin inhibitors. And these ones are divided into two. We have those ones which are univalent, and this one bind on only one active site of the thrombin. And these ones we have agatroban, and the bigatron. And we have those ones which are divalent. These ones bind on the fibrinogen binding site. We have drugs like desiludin and bivalirudin. So these drugs, since they have an indirect factor 10 effect, inhibitory effect, they are very good in treatment of. They can be used in treatment of heparin-induced thrombocytopenia. About is warfarin. And to understand the mechanism of action of warfarin, the effect of warfarin, we have to be having in mind the role of vitamin K in blood clotting. Vitamin K is responsible for activating production of active factors 9, 10, 7, and factor 2. And how does it do it? By carboxylation. So by carboxylated factors. So once these factors are carboxylated, they are going to become active. And what happens? We are going to have reduced vitamin K being converted into vitamin K epoxide. And after the carboxylation of these factors, this vitamin K epoxide is going to be converted back to reduced vitamin K by the enzyme vitamin K epoxide reductase. What warfarin does, warfarin comes and inhibits this enzyme. So once this enzyme is inhibited, we are not going to have conversion of vitamin K epoxide to reduced vitamin K. Remember, we need reduced vitamin K so that we can carboxylate and activate these clotting factors. So without these clotting factors, we are not going to have the intrinsic and extrinsic pathways going on. So we are not going to have clotting, we're going to have